Welcome to Orthodontic Smiles, a podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontic Society. Today on Orthodontic Smiles, we have one of the up-and-coming members of the American Orthodontic Society, Dr. Cody Shores. I asked Dr. Shores to do an interview on Orthodontic Smiles because I've been in practice for 40 years and have integrated orthodontics into my practice. I thought it might be interesting to get the perspective of a relatively new practice owner and a new orthodontic provider in a general practice. I will try to get him to help us understand why he sought out orthodontic education and how it has helped his new practice. Cody is a little different than most young dentists. He's aggressively pursuing every aspect of orthodontic education, implant dentistry, and cosmetic dentistry. Since his graduation from Oklahoma University School of Dentistry in 2012, he has been an associate and now has opened his own practice and has been in that practice for 4 years. I want to know how orthodontics has helped his practice. He is the president-elect of the Oklahoma Academy of General Dentistry and is on the education committee of the American Orthodontic Society and a member of many more dental organizations. So let's get with it and interview Dr. Cody Shores. Welcome, Dr. Cody Shores, to Orthodontic Smiles. I've waited a long time to try to get you on Orthodontic Smiles. It's a pleasure to have you with us. You're one of our up-and-coming new members of the American Orthodontic Society, and orthodontics has treated you well. Tell me why you got started doing orthodontics as a general dentist.
Well, I just kind of looked at my area. I always knew I wanted to get into ortho, even before I started dental school. I had a mentor of mine that he had went through a lot of the American Orthodontic Society program years ago, and he got me talked into it and pointed me in y'all's direction. And his name's Jesse Storts, and I can't thank him enough for pointing me in y'all's direction, because the programs have been amazing and really helped me to implement it into my practice.
That's great. Now you took tell me who you took your courses from. Now these are comprehensive orthodontic courses. They're not minor tooth movement courses. They're not fixing just the lower incisors. They're not just 6-month smiles. They are comprehensive courses where you're putting brackets and bonds on and bands on all the teeth. So it is a comprehensive course. Who did you take your first course from?
Well, I started out with David Jackson, and I went through level 1 with him, and I made it halfway through level 2, and he passed away. And Brad Williams took over at that point and did a great job taking that torch and carrying it on, and he's doing a great job with his programs now, and I'm just sure proud of him and what all he's done.
Yeah, he has really taken the bull by the horns and has done a fantastic job. It's pretty good thinking on the part of Dr. Jackson, because he kind of mentored someone to do some teaching, and Brad Williams has done a great job. Now you graduated from University of Oklahoma in 2012.
Yeah.
And then you were an associate for how long?
I was an associate for 2 years, and then at that point, I went out and started my own practice, did a scratch startup, and June will be 4 years now that I've been out on my own. So
Boy, young practice, you doing well?
Yeah, we're doing good. We're just like, we're an oil field town, and so oil dropping hurt us, but we're doing good in spite of it. So, and that's really because of orthodontics. We have one orthodontic specialist in the town, and he's I've heard that he's down to 3 half days a week. And so it's really kind of me in the town doing it.
Are you getting referrals for the orthodontics, or are you picking those cases out of your base of patients?
Mainly getting them out of my own patients. And I tell you, I get a lot of patient families just because they find out that I do orthodontics, and they come to my practice just because of that. And then the whole family ends up coming over. And I do get some referrals, but mainly it's just families that don't want to go anywhere else. They want to go to a practice that pretty much does everything and takes care of their whole family.
Well, I know you took the American Orthodontic Society's course in orthodontics, that comprehensive course, and I was going to ask you how it helped your practice, but you just told me you're getting patients as a result of being able to do orthodontics. But that's not your only interest. I mean, you seem to be out there doing, you spoke to me about the fact that you're doing some implant dentistry and a lot of cosmetic dentistry, and people in your area, which I understand is a rural area, really appreciate that.
Oh yeah, it's, we, other than the orthodontist, we have a oral surgeon that comes in one day a week, and other than that, it's 45 minutes away for anybody else, for any other specialist around here. And so I've just really tried to go out there and get as much things under one roof as I can, and we're even venturing out into I've done all this implant stuff, but we've ventured out into platelet-rich fibrin, and we're bringing that into the practice. We've been doing that for a year now, and we're starting to branch out and doing it for cosmetic facial facelifts and things like that. So we kind of dabble in a little bit of everything.
Well, you need to do that when you're out in the rural area and you're trying to help the patients that you have, not having to travel to other cities to get these kinds of services. So that I commend you for that. That's really good. Now, how did you adapt the orthodontics that you learned into your practice? I mean, the reason I ask that question is that I've taught quite a few people in orthodontics, and one particular pediatric dentist came to me afterwards, and he says, I love to do interceptive or early treatment orthodontics, but I can't seem to adapt it into my practice. I'm so busy doing other things that it's hard for me to do orthodontics on top of it. So how did you adapt to your practice to doing orthodontics in it?
Well, we just put it in right from the beginning and just made time for it. And some people have problems with that because it needs to be treated like a hygiene check, and come in, check the patient, and your assistants do 80-90% of the work.
Exactly.
Whereas I think some docs are trying to do everything, come in and change the wires, and that creates a problem. Yeah, you need to have time booked out and save for certain procedures, hour and a half or whatever it takes you to band and bracket a case up. But it really should be a 5-minute thing. Come in and say, okay, let's move to this wire. We need to run class 2, class 3 elastics or whatever it may be, and walk out and be done.
And so that says a lot for your assistants. Did they go through the American Orthodontic Assistance course?
Yes, they went through Susan Coffey's course, and she did a great job with that course. And I sent my assistant to both of her beginning and advanced course, and she came back and was able to do 80% of what she learned after that weekend. And it takes some coaching because we forget things and things like that, but she's able to do everything now. So
now, she didn't take the course with you when you took the full comprehensive course.
No, it was its own separate course. So
I know some of the doctors bring their assistants with them so that they basically are learning, and the assistant is learning right along with them. So that's an option that the American Orthodontic Society provides for their assistants of practices. But you seem to have done it the right way, and most dentists don't realize how little time it takes them in their practice day. You won't appreciate this, but I've been doing this for 40 years, but and treated quite a few orthodontic patients in all those years. but you won't appreciate it as you get older, like I am. You look forward to an orthodontic patient coming in and sitting down after doing a whole bunch of restorative cases on 2 and 3 year olds like I do. You look forward to that orthodontic patient coming in, and you clear your mind and you sit there and relax a little bit and take a look at that orthodontic patient and kind of really, it's a miracle what we've been able to do for our patients when you do orthodontics. What a wonderful thing. What a wonderful smile they have when they're done.
Absolutely.
And it just brings such a joy to me and the parents as we deband them. So,
oh yeah, and you see the change in that kid when you start with them. Most of them are shy, but they don't want to smile. Their teeth are crooked, things like that. And then when you finish, they're just so happy. You know, they're proud of the way they look, and it's just good to see that change.
Cody, how many dentists do you have in your community?
We have about 12 dentists in town.
And do any of the others do orthodontics in their practice?
There's one that does. He went to Brad's level 1 course, and he does a few cases. We take Cephs for him, and there's another one in town that does fast braces. I don't know much about fast braces. I think it's pretty much a one wire technique from what I've understood. And so we have those two doing it, but other than the orthodontist, no one's really doing it to the level that I'm treating.
How many patients did you start right after you got out of your comprehensive training?
I started about 50.
50 in 1 year?
50 in 1 year. Yeah.
And what would your average fee be for one of those patients?
For class 1, I'm charging about $5,000, and it ranges up to class 3 of about $5,800. And the more and more I treat those class 2s and 3s, I want to raise my fee a little bit.
Exactly. They take a little longer, but you realize what you just told me. You told me you've treated 50 at $5,000 average. That is a lot of practice income that came into your practice because of the fact you learned orthodontics. That is remarkable. That is remarkable. Yeah. That in itself is you're doing wonderful. You're doing
thank you.
Really
thank
good.
you.
And that's only going to increase as time progresses and the people in your community find out about you. And the word will spread, and they'll be coming to you just to get the orthodontics done, which is something to look forward to as you mature in your practice. Now, this is only 4 years in a rural community, and you're doing this well. Imagine what it would be if you were in a suburb of a big town, and we're doing the same thing. So that should be encouraging to anybody out there that is thinking about doing orthodontics. What would you say to them if they were just even thinking about doing orthodontics?
Go ahead and do it. Get in the course, learn it, and get your feet wet. And you're going to make mistakes. There's going to be problems that happen. There's going to be appliances that pop loose and break and things like that. But push through those failures, learn from them, and keep pushing forward and learning from them.
Did you ever feel uncomfortable doing the orthodontics, that you felt like you were out there by yourself and nobody would help you?
No, absolutely not. I always felt like I could call anyone that I know through the American Orthodontic Society and get help. Send them photos, send them the case, and ask questions and say, "Hey, I'm having this problem. What should I do?" I've got someone that I mentor in Norman, Oklahoma. So the AOS assigns mentors to every student that goes through the program, and it's just up to you to utilize those mentors and all the programs that the AOS has.
Well, you're not unlike all of us who've started doing orthodontics early in our career. There'd be nights where you'd sit and think about what you did during the day, and you'd say, wow, I wonder if I should
Yeah.
have done that. And you go back to the office the next morning and you tell your staff, call that patient up, have them come back in a week instead of a month. I just want to take
Yeah.
a look at them and see what and how fast that bend in that wire is going to make a tooth move. And you learn
Oh,
from
absolutely.
that, actually, and you know, it may be a little bit of a challenge for the patient, but you're learning as they are getting treated, and that's the important thing. After a while, you know what's going to happen.
That's right.
And it just takes a little bit of time of doing it a few times, and you can learn from your own mistakes as well as your own challenges and successes. Yeah. Exactly. So, are you doing anything that is directly aligned with orthodontics, like any treatment of TMDs?
Yes. TMD's a pretty big part of my practice. That's something I've had a passion for. My mother's had TMD problems. I've had TMD problems, and so it was just kind of natural fit for me because I understood what those patients are going through, and orthodontics is a perfect fit for that because not all the time do you have a patient that's worn their teeth down that need a full mouth rehab to get rid of TMD problems or other aspects. Orthodontics is a very good phase 2 completion for a TMD case. And, you know, I'm trained in Pankey and from a Pankey guy down in Waco, and I've Spear Study Club, and I do Guild 47 is kind of my deal. So once you open them up and get them in that orthodontics is a perfect fit for that because you extrude the teeth, get them into that position, and retain that position. And those patients, they're very appreciative of what you do.
Gets them out of pain. That's
oh man, yeah, and you know, a lot of people don't want to treat TMD and things like that, but I think it's kind of a disservice. You know, you should treat those patients and learn how to treat it because, man, to live with that type of pain every day is a miserable life. And if you can change somebody's life by getting them out of pain or even getting them 80% better, that's what I always tell my patients. My goal is to get you 80% better. This joint has a problem, just like any other joint in your body. I can only get it so far, but I'm shooting for 80%. And most of the time, it's such a huge difference from what they were in, the type of pain they were in to now. It's a life-changing deal for them.
Cody, have you gotten into any of the airway things that we're looking at, like sleep apnea treatments? And that seems to be one of the really big things that's up and coming for the general dentist. We had one of our Orthodontic Smiles podcasts with Dr. Zita Anisi, who is a diplomate of sleep medicine, and boy, she is really just kicking it with treating patients that have sleep apnea.
Oh yeah, she is so smart on the sleep apnea stuff. Yeah, sleep apnea and TMD, they all run together. If I start somebody that's got sleep apnea and they've got TMD, I mean, they just run together all the time. And I'm looking at treating the kiddos and expanding the arches earlier on so they don't have those sleep apnea and TMD issues like they would in later in life. That's why we're just now getting into this myobrace stuff, and it's all about getting that the function of the muscles in the face and the tongue all working together and letting the airway develop the face.
Yeah, that's very, very true. And I bet you the next thing you'll probably purchase in your practice will be one of the 3D imaging systems that really can measure the airway. I believe that in the future that this type of imaging will be the diagnostic tool that we will use in children especially, because they by enlarging the maxilla and expanding, we provide a bigger airway, and that's measurable now, which we didn't know before. we thought all we were doing was just widening the maxilla, but really we're providing them an airway that could potentially keep them from having sleep apnea in their adult life.
Yeah, and I already have one of those 3D imaging machines. I have a Sirona Galileos, and so that one I can look at the jaw joints and the airway, and it's a good machine. It is.
Well,
I couldn't practice without it.
Obviously, you're state of the art already, and you've only been in practice 4 years, so that's just remarkable. So you're doing great. And what other aspirations do you have? Being a member of the AOS, I know you're sitting on the education committee of the American Orthodontic Society. That committee is what reviews all the courses that are being provided to our members and it approves them for being a teaching exercise for all those that attend. But what other aspirations do you have as being a member of the Orthodontic Society?
Well, I never would, it's one of those things. It's like until some people, push you to think you can start doing it like you have. You've told me a couple of times, future president of the AOS, and after hearing you say that a couple of times, I want to be on the board and I want to be president one day. And I of course I want to get my board eligible and my diplomate and do things like that. But I want to be president. I want to help an organization that has given back to me so much. And right now, Dr. White, he called me probably 6 months ago, and he asked me if I'd start a AOS study club in Oklahoma. So that's another one of my aspirations for the organization is get this study club started for Oklahoma. And hopefully, I know y'all have had one in Florida for quite some time, haven't y'all?
Oh yeah,
yeah.
We've in our area we've had one since 1983.
That's awesome.
Around 83 or 84, something like that. So it's still ongoing. It's a great study club.
That's amazing.
That's the way we have not necessarily learned orthodontics, but when you sit around with 10 people who have had the same education you did, going to the American Orthodontic Society courses, and then you sit a month after month together reviewing cases, you really start to learn a lot of orthodontics because you're looking at their cases, they're looking at your cases, and study clubs are remarkable ways to learn anything, whether it's going to be implant dentistry or sleep apnea treatments or doing orthodontics. So
absolutely,
I think also, I'm kind of an encourager. I always encourage you. I think you've got a future in lecturing as well, and I think Brad Williams already has gotten you out there teaching a little bit, hadn't he?
Yeah, he has. For 2 years in a row, he had me do the TMD section of his intermediate advanced orthodontic section, and I tell you, it's just I'm just so blessed to have him as a friend and to give me that opportunity because I hadn't lectured much, but I knew the topic, and he gave me the opportunity to step out there and really kind of get started. And I've had a couple of lectures since then, and it's always I absolutely love doing it.
Well, I hope that there's a lot of people out there listening to this podcast that might be interested in becoming a member of the American Orthodontic Society and taking some of our classes. If you're a young pediatric dentist or a young general dentist starting out there, I think probably when they heard how many cases you started and what income it can bring to the practice, that might encourage them to want to get started with doing some ortho in their practice. So if they are interested, and that's why I wanted you on this broadcast, because your enthusiasm for orthodontics and what it's done for your practice is really a wonderful thing, and an encouragement. It's an encouragement to other dentists your age that are just getting started in their practices. But if they are interested, all they have to do is go to our website from the American Orthodontic Society, which is www.orthodontics.com. www.orthodontics.com. And that's our site. You'll be able to see all the courses, how to enroll in our classes, how to become a member, and all the other informations. And you might as well look on the front page and tune in to Orthodontic Smiles by just clicking the link on Orthodontic Smiles. Cody, I'm so grateful you have come on to the podcast and talk to us about your practice and how orthodontics has built your practice and the kinds of things that you learned and how you learned them. That's why I wanted you on, and you've done a great job of explaining that. Thank you.
Well, thank you for having me. It's always a pleasure, and I'm humbled and honored for you from you asking me, because I sure think a lot of you and appreciate everything you do for all the students that go through your programs, and everybody that's in the AOS.
Well, thank you. That'll conclude our interview. Thank you very much, Cody Shores.
Thank you.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.